Hello, everyone, and welcome back to Raising the New Earth. I'm your host, Noah Dory, and today we're speaking with Sarah Hertzberg. She is the lead clinical outreach manager for Amen Clinics. If you don't know what Amen Clinics is, it is a group of mental and physical health clinics that work on the treatment of mood and behavior disorders. It was founded in 1989 by the amazing lead psychiatrist, Dr. Daniel Amen. And Sarah works closely with health practitioners to help enhance patient care and ensure providers can support their clients in reaching their full potential. So today we're going to explore Sarah's insights on the future of mental health, the power of collaboration, and Sarah's personal approach to wellness. Let's dive in. Hi, Sarah. How are you?
I'm good. How about you?
I'm good. I'm excited to have you on our podcast. So tell the listeners a bit about your personal and professional background. What inspired your journey to focus on healthcare outreach?
Sure. Well, I actually graduated from college. I went to Chapman University in 2020. And, as you can imagine, that was a challenging time to graduate from college and begin looking for a job. And I actually was thinking I was going to take more of a business type approach. I thought maybe I would go and, be an accountant or something along those lines. And when COVID hit, I noticed amongst myself, amongst my family, friends, that, a lot of people were really struggling and that, it seemed like the whole world were experiencing all types of mental health symptoms, whether that was anxiety or a low mood. And so I started thinking for myself even, how can I get myself out of this, low mood and anxious thoughts and all of these things. And so I started doing a lot of research. And I was listening to podcasts, which is so cool to get to be on this podcast. But I was listening to podcasts, I was looking online and trying to figure out, all these different things about mental health and how we can best take care of ourselves. And I was listening to a podcast and stumbled on the company that I work for now, which is the Amen Clinics. And so I was listening to this podcast and I heard our founder, Dr. Daniel Amen, talking about brain health and the work that he does. And I listened to that and I was like, wow, that's something that I would love to be part of. And so, fast forward now, I've been working with Amen Clinics for about 5 years and have really grown to be passionate about, exactly what you described in terms of, mental health. How can we, increase the mental health of our community? So that's kind of how I got started.
That's incredible. So describe us your day-to-day chores and responsibilities.
So, in terms of my work now, my role is within outreach into the community. So, my goal is to go out and connect like-minded providers, whether they're, nutritionists, dietitians, therapists, physicians, all types of professionals, and work together as a community to try to, better the mental health, specifically of Southern California. So my day to day is, doing things like this where I get to interact with professionals, really being a resource for patients within the community and making sure people get the right care.
And what do you think building relationships with healthcare professionals um, do to the patient who is looking to work with them?
So I think that building relationships with healthcare professionals is the most important thing because, one thing that I find is there's so many amazing professionals within the community, and we're not all able to do everything. So if we can all, specifically work within our specialty and work with other people that are working in their own specialties, I think we can give patients the best of everything in that way.
Mm-hmm. It actually
Yeah.
makes sense. How do you encourage therapists and psychologists and family physicians? How do you encourage them to integrate or perhaps look into Amen Clinic's approach and services into their own patient care and plan?
Sure, that's a good question. So in terms of integrating with us, I always say it's, a collaborative approach. So, we need other professionals just like, we can help the community as well. So, what I would say is twofold. So, on one hand, where we specialize as Amen clinics is in brain imaging and getting to the root cause for patients when they are experiencing, more complex psychiatric conditions.
Mhm.
So, we're really able to help with patients that are, really struggling. They've tried and failed, different medications, they've tried and failed different treatments, and they're just not quite getting better. We're really a resource for professionals who are experiencing, working with those types of patients. And on the other side, we also, as Amen clinics, work hand in hand with other professionals. So, most of the patients that come to us, they are, getting brain imaging where we're looking to, see what might be going on in their brain. And once we've uncovered what's going on and causing some of their symptoms, we create a really thorough treatment plan with all types of recommendations, whether that's therapy, whether that's consulting a nutritionist, whether that's, going to another, physician who might be in a completely different specialty. So it really depends in that way. But I would say for any healthcare providers to, feel free to collaborate with us. I know you'll leave my information at the bottom as well, but it's really a collaborative approach. We need other healthcare providers just as much as, we can also help the community.
Hmm. I totally agree. And well, for those that don't know, Sarah and I, Sarah reached out to me on LinkedIn after I started referring a lot of my personal clients to Amen clinics because to me, and if you're not aware of Dr. Amen's work, he is he has revolutionized the way that we look into brain. I believe that before SpecTrain was introduced, there was really no way of looking into the brain and diagnosing the exact location of what is happening inside the brain, which is really weird. It's the only profession that doesn't look into the brain, and then you prescribe heavy medications, but you don't really know where you're hitting. And so learning about Dr. Amen's work, I always was the one who I worked for a mental health facility for a long time. And I was always the one who recommended and quoted Dr. Daniel Amen to other psychiatrists that were in a hurry to prescribe, nothing against meds, but you really need to know what you're prescribing, who you're prescribing it to, and to understand that one size doesn't fit all. So I got familiarized with his work early on. And what you're saying about brain health, that's something that we heard Dr. Daniel Amen talk a lot about. So how does he differentiate mental health for brain health? If you can elaborate a little bit on that.
Sure. So it's actually a huge piece of our mission. Our mission is to end mental illness by creating a revolution in brain health. And what we mean by that is, of course, helping the community with regards to mental health, but specifically, we're trying to change the paradigm from instead of focusing on mental health, we're looking to rephrase it as if it's brain health. So we view mental health as something that is, just the same as if someone, broke an arm, as an example. If someone breaks an arm, of course, they're going to go to the physician. They're going to, maybe get an x-ray. They'll check it out, do the next steps to help resolve. We view brain health just the same way. So if someone is having emotional, issues, if someone's having trouble with their memory or their cognition, if someone's, tried and failed lots of different medications like you described, we view it the exact same way. So, just as if someone broke their arm, we view that if someone's experiencing these troubles, it's kind of like the same thing. And, our goal is to be able to quantify and bring some objectivity to what can seem so subjective to a lot of people. So by coming in and actually taking a look at the organ that we're looking at, it's changing the paradigm to instead of focusing on mental health, which is something that people can't quite conceptualize sometimes, we're able to really bring objectivity. It's just like any other organ in the body. And that's really how we're trying to change the paradigm.
And I think you're doing it beautifully, beautifully.
Thank you.
Can you share a moment in your career where you felt you truly made a difference? And I know that there's many stories, and I read and I heard from patients, but a particular story where you felt you really made a difference in for a patient or a provider.
Mm-hmm. That's a great question. So, the story that comes to me is we had a specific therapist that had referred a patient to us, and this patient had been struggling for a very, very long time. They had been, trying and failing many different medications. It ended up that because they were struggling so much, they ended up in the hospital at one point, and they were basically told that they were just psychotic in a sense, and that it was just because of the certain medications that they were taking that they're experiencing all these different symptoms, and that there is kind of nothing they can do. Like, this is just the situation. We just need to make you stable, all these things, which is something that we see all the time. But this therapist was consulting some other therapy or therapist group, some other colleagues. And one of the colleagues in that group had mentioned Damon Clinics and had suggested, coming in for a scan for that patient, and just kind of seeing if there was maybe anything else that we can do. And so we basically figured out that with this specific patient, that everything that they were experiencing was so much more biological and so much more tangible that we were able to help with. And we were able to specifically see that a specific medication that this patient was on was in fact causing all of these symptoms. But unlike what the hospital had said, our psychiatrist had worked with this patient to have them actually come off of this medication, and found a couple other medications that would be much, much more appropriate based on the biology, based on the imaging that we were able to do. So it seems like a very small switch, just switching medication, but for this patient, they were able to get their whole life back, because this specific medication that they thought they had to be on for the rest of their life made them almost like a zombie in a way. Like, they weren't able to feel anything, they weren't themselves. And so, of course, slowly, our doctor was able to slowly take them off of the cocktail of medications that they were on and put them on something a bit more appropriate. And that was really helpful for this specific patient. So it's a story that we see in so many different examples, but it's the first that comes to mind.
Seemingly a simple solution, which I think it should be used as an encouragement to those who listen to the podcast. I see it a lot. Much of my time is spent on looking at labs and looking at pharmaceuticals that are given to a patient, and seeing if there is a polypharmacy, which is when someone takes more than several drugs at the same time. They may be not interacting properly and creating a lot of side effects. So everyone can do it. You can just, you can Google the drug that you're on that was prescribed to you, and see the side effects. If one of them is something that you feel you are experiencing, take it back to your primary care physician or someone else, a health practitioner, so they can help you slowly get off of them and perhaps find a different medication. But I see it in so many cases, and so many times where I have to collaborate with a doctor and just in a mindful way, just reminding the doctor to revisit the meds list and perhaps prescribe something else if there's still a need for that.
Absolutely.
It's an important, warning label when you take any medications that can really chemically alter the way you behave. So these are hard meds that are often necessary, but just be mindful of the side effects that they often come with.
Exactly.
What is a common misconception about that you maybe have come across about brain health or mental wellness that you wish more people understood?
I think one misconception is that, you have to have a really thorough like supplement regime, and you have to do every therapy out there, and you have to, like I think there's so much in today's world that's out there, which is amazing for mental health. But I think sometimes it's very easy to get stuck in the weeds, like really focusing on every specific area that's out there. But I'm sure you could agree with this. Sometimes it really comes down to the basics, like focusing on having a healthy diet, focusing on having a healthy exercise regime, focusing on your social circles, your family and friends, spirituality. All those areas are such important elements that if we can just get the basics right, I think that puts us pretty far along. So I think that would be the misconception is you don't have to try every new supplement. You don't have to try every new therapeutic regime. You can really focus on the basics, which will really help a lot of people.
I agree. Just come back to the basics. That's true.
Hmm.
I think
Yeah.
it's an era of a lot of information we're being bombarded with from a lot of different directions by a lot of influencers, whether
Hmm.
they have legit credentials or not. It's just a lot of opinion. Even between MDs or dietitians, you'll hear different opinions. The fight over which diet is best, has just begun. Like, what do subscribe to? Do you do low carb, low diet, paleo, keto? At the end of the day, for me, if I may add, for me, it will be make sure that whatever diet you follow, it's got a lot more of whole foods in your daily intake than anything else, which
Hmm.
brings us back to the basics, right? I rather eat real food.
Absolutely. Yeah.
If someone is listening right now wanted to take one concrete step and you started sharing it with being back to basics, concrete step towards better mental health for themselves or their family, what would you suggest?
I saw a study that came out not too long ago, and I can try to find it if you want to link it in the notes.
Mhm.
But there was a study that came out not too long ago that our psychiatrist, Dr. Storage, actually shared with us. But there's a study that came out, and this could be totally wrong. This is just off memory, but I believe in that study, the results were that if patients are able to do 4 times a week, 20 minutes of high intensity exercise, that's more effective than an SSRI medication. And I think that's huge. It's so easy to be able to go out and do 20 minutes, whether that's, speed walking, whatever you can do, doing jumping jacks, if you don't have much space, anything like that. But I think that can really help a lot of people today. It's something that you can start off. And even for myself, sometimes a couple days will go by and, maybe I was busy or I didn't have, the time or bandwidth to do any type of exercise, and I can feel it. It completely dampens my mood, my energy, my mental clarity. So I would say that would be my top recommendation I've heard about recently.
I agree. And at the mental health facility, I used to do session on the move. I didn't like sitting in the office, so and the facilities were always surrounded by beautiful mountains, and the weather in California is perfect. And so I used to take my patients on a hike or just around the block, and 99% out of 100%, they all came back already better without us needing to sit in a closed office. So yes, absolutely. Movement is key. Depression, anxiety, it's very, very helpful. And you just mentioned your own personal routine. Were you a dancer?
I
Did you?
was.
Okay. So how did
Yeah.
you how did you go from being a dancer to studying, how did you transition there?
Yeah, well, I was a dancer my whole life. And then, even in college, I, taught dance for many years. And then I think there's a lot of synergy actually. Maybe now I'm actually thinking about this. I've never been asked this question. One thing that I find really interesting. So I came through our Amen Clinic's evaluations when I first started with us. And I did the brain imaging myself. Just for anyone that isn't quite familiar with it, it's called SPECT imaging. We're looking at blood flow to see what parts of the brain are overactive or underactive. And so when I got my brain scanned, they told me that my cerebellum was underactive. And their top recommendation for that was rhythmic exercise.
Mhm.
And interestingly, at this point when I got my brain scan, this was in 2020, I had just stopped teaching dance and doing any dance. And so it made me realize that the rhythmic exercise, like dance or a spin class or anything like that, is so crucial for me and my brain. And so I've been now, trying to incorporate it over, but I there's definitely a lot of synergy there for sure.
Absolutely. I always say to people, to my community, if you see me a little snappy, I call it Miss Snappy, it's because I haven't worked out today. I'm always a better person after I worked out. And I know that our day can be full with to-do lists, especially for other people, but I always say put yourself on that list. Make
Hmm.
yourself number one on that list, because if you can't give to yourself, you can give to others. So what you're saying makes perfect sense. Yeah.
Yeah.
So what has been the biggest challenge for you in your role as a clinical outreach leader? What does this role teach you about people, healthcare, and yourself?
Hmm. That's a good question. Um, I think this role, first, it really shows me kind of what we were talking about earlier. I think that a lot of times, because there's so many amazing resources out there, especially in LA, there's a million amazing, clinics that you could go to. There's so much holistic or integrative care out there. And so sometimes it kind of feels like option paralysis in a way, where
Mm-hmm.
there's just so many options out there. It's hard to know what's worth your time. And I think sometimes that makes people just kind of stop. It's just a little bit too overwhelming. It's hard to get started. And so I think that's one thing that I've noticed to be a challenge is, giving people direction and trying to prevent a little bit of that option paralysis and really, earning people's trust, because when there's so much out there, it's really hard to, choose. Sometimes it can be so overwhelming to just get started. So I would say that's a really big thing. Um, I also think that sometimes, interestingly, sometimes it's hard for even clinicians to be able to look at their own selves. So, a lot of times, especially with the work that we do with the brain imaging, it can be hard for people to get started because they're fearful that, maybe we're going to find something in the imaging that they don't want to see. Maybe there will be something in there that they don't like, or, all types of fears, really. And even with clinicians, I've had that same
Mm-hmm.
conversation. I had a therapist that sat in my office not too long ago, and she was talking about how she really wanted to come in and, try out our experience. So that way she'd have a better understanding for her patients. And she was like, well, but I won't go until next year because I've just had a tough year. I haven't been treating my brain very well. And
Mm-hmm.
so I think that's something really, that's there. And my thought to that is always, why not look? Because if you are able to see something, then we can help. And the amazing news is that we've over, 250,000 scans, we've been able to see that people can improve their brains. And so even if we do find something within someone's scans, you're not stuck that way. It's something that we can absolutely help to improve or to get rid of or anything like that. So I'd say that's my one challenge that I'm definitely seeing.
Mm-hmm. And I know that the Amen clinics also allow the patient to have a lot of responsibility, which is something that this is how my practice runs as well. There's a lot of personal responsibility. There's no magic pill. I'll
Mm-hmm.
guide you, but the work really needs to come from you. And so how much resistance do you see in patients where they're told that they may need to change their lifestyle in order to better their health and their brain health?
Mm-hmm. Oh, it's really hard. It's something exactly what you're saying. It's, the patient has to want to make those changes. We can, find all of these suggestions. We can, set them up for the right path, but if they don't walk themselves down the path, we can't really do anything. So, that is a really big challenge is in terms of the follow through. What I will say is that our doctors do a really nice job about trying to create stages. So, for the first 2 weeks, we can tell someone that, their treatment plan could consist of increasing their walking or,
Mm.
trying, one vitamin that they might be deficient in or trying to avoid one specific thing in their diet, as an example. So, really breaking things down into stages so that way it's not just like everything all at once and then they have to somehow pick up all those pieces and put it together. Because a lot of times the patients that are coming to us are very down. They've tried so many things, they might not have a lot of energy. And so sometimes for those patients, especially, it's really hard to get themselves on board with the big treatment plan. So I think really putting things into stages can be the most helpful way to go, and having your friends, family, anyone to be there for support. So that way they can have a little bit of accountability as well.
That's a very important advice. Yeah, instead of being overwhelmed by all the changes that they have
Mhm.
to face and start doing, you're doing it in stages. Yeah. Yeah, I've been at fault before of, having clients or patients and them needing to change everything. Not
Mhm.
everything, just I always say everything that you've done has got you this far. So if you want to change the result, you got to change what you do. So unless you take that leap of faith and dive
Mhm.
in, I can only be there in, as your cheerleader, but that's all I can do.
Absolutely.
Yeah, so stages is important. Yeah. So looking ahead, what are there any emerging trends in mental and brain health that you're excited about?
Yeah, there's some amazing things going on. Trends in brain health. I think, one thing I do believe is that, we've been on the cutting edge for, over 35 years now with looking at the brain. But I think that hopefully this will become a trend to actually be able to look at the organ that we treat. And, we're not the only ones that are able to do that in some capacity. There's a lot of other types of imaging, whether that's fMRI, whether that could be, QEEG. But I think that the whole field is actually really opening up to the idea of really looking at the brain, whether that is through SPECT or any other type of instruments, and really looking from a root cause perspective. So I think that's where the mental health field is going for sure.
Hmm. Yeah,
Yeah.
I agree with you, and I applaud that expansion. It's very much needed.
Yeah.
Tell us a little bit about the use of hyperbaric chambers in the clinic and how you have seen it being helpful with brain injuries, concussions. I know you treat a lot of NFL players at the clinic, so tell us more about this particular modality to help with that.
Hmm. Yeah, so hyperbaric oxygen is a very popular thing for any listeners that might not know exactly what we're referring to. Hyperbaric oxygen is where we basically stimulate oxygen into your whole body, which helps to bring more blood flow. So, the way I always explain it is it's very similar to scuba diving. So, we are going down in pressure, and that's what helps to bring the oxygen and blood flow into those areas that need it the most. And you're absolutely right. We use this a lot of times with athletes like NFL players. We also have used it with many other types of sports, but it's very helpful when you see the before and after images. We can actually see, especially with football players, if there might have been a clear hit to the head in a specific area. And after, a specific amount of sessions, that blood flow really tends to fill back in those areas. So it can be a really powerful tool.
I believe it's a very, very powerful tool that is often being overlooked. And
Mhm.
I have personally come across patients of mine and clients of mine that have been diagnosed with um, a disease such as bipolar and happen
Mhm.
to be a concussion that happened earlier in life. So how many of those cases do you see in your clinic
So
misdiagnosed?
I would say a lot of the patients that we see have something going on that they didn't realize. Our actual statistic is 79% of patients come out with a different diagnosis. So that could mean that we did find a traumatic brain injury that they didn't know about. It could mean that, they lived their whole life and they thought that they had ADD. But
Mhm.
really, what we're seeing based on the scans, but also taking a thorough history, is, it actually seems like PTSD based on what we're looking at. So we see a lot of misdiagnosis, a lot of new diagnosis that, people may not have realized.
Yeah, and ever since finding out about Hertzberg chamber, oxygen chamber, I have listed on my new patient form if the patient has suffered from falls or concussions in the past, just so I can look into perhaps, recommending that as a modality if needed. So, yeah. I
Absolutely.
know that Amen Clinics is a very patient-centered care. How do you foster a collaboration and engagement among providers and among staff members to maintain this focus?
hmm Well, that's a good question. So, I guess to start with staff members, within the Amen clinics, we actually have what we call our non-negotiables.
Mhm.
So it's basically principles that our entire company works based off of. And it's all about patient care and keeping patient focus and things that we should be mindful of, whether that's, that patients might be coming in and they might be very anxious. And so we want to make sure that when we're working with patients that we work with them very quickly, that we're, very calm, that we have lots of patience for them because they are dealing with a lot of things. So our staff is highly, highly trained on principles that we have to keep in mind when working with these patients. It even comes into, small areas, whether that's, if we have a kid coming through and we're, able to provide them with some things to distract them a little bit in the waiting room, whether that's, a coloring book, even as simple as that, but can make a really big difference for patients and their parents. For working with professionals, I would say one thing that I know to be true is that professionals really do care about their patients that they're working with. And I know that for a therapist, for a physician, for, you even, if you're referring a patient to us, you want to make sure that they're going to have a good experience. The worst possible thing would be to refer a patient somewhere and then it didn't go as expected, or it, wasn't a good experience, or something, negative happened. And so my goal is that when providers are trusting us, that we are able to really maintain their trust, to show how much we value that trust, and to go above and beyond to give patients the best experience we can. And of course, everybody's human and sometimes something will, slip, or sometimes something happens. But, really my commitment in my role is to make sure that when providers are working with us, that they're experiencing only the best from our clinics, and that they're also given full collaboration. So that means that once patients come to us, if they're getting scanned as an example, we send them all of the reports. They know exactly where we're at with our patients. So that way they can also help to implement whatever we're suggesting. And really that helps the patient at the end of the day.
Yeah, I agree. And speaking of professionals, what advice would you give other healthcare professionals who want to improve patient outcomes through integrative approaches like those at Amen Clinic?
Mhm. So, for those types of professionals, there's so many different things I can think of, but one thing that maybe we can link below, we actually have a brain health certification course on our platform called Amen University. And it's a deep dive on all types of, nutrition for the brain, supplements for the brain, blood work that might be interesting to recommend for different conditions. So it's really like a deep dive in terms of integrative care, specifically when it comes to brain health. And so that's something I would highly recommend. It can be done completely from home. It's pretty quick, but it really gives you a strong background on our method that we've studied for the last 35 years.
And what's the name of the course?
So we have a couple different course options, but the newest course that just came out for healthcare professionals is called our Elite Brain Health Certification.
Mm. Okay, we'll link it in the show notes.
Sure.
Beautiful. Yeah. There's also a test that our listeners can take online, right? To guide them through is it like a brain test? What is that test that you can take online and figure out what you may have?
Yeah. So it's completely free. We have what's called a brain health assessment. So it's just brainhealthassessment.com. We can link that as well. And it's maybe a 5-minute test, but it will give you a brief scoop about, your specific brain, things you might be experiencing, and suggestions.
Yeah, I find it to be very helpful, even with my own family members who don't live in the US and can't access Amen Clinic, at least not physically. But having them do the brain health assessment online gave them the perspective they needed and another added tool to take to their therapist. So we did that together. Also, I'm still reading Dr. Amen's book, You Happier, which is incredible. It's the 7 neuroscience secrets of feeling good based on your brain type. And I was so impressed with that book that I'm thinking of incorporating it as well into my practice.
Amazing.
It's can you tell us a little bit about the book?
Yeah, so we have quite a handful of different books within Amen Clinics that Dr. Amen has written, but it's for You Happier specifically, the way that I like to describe it is it's something that's a little bit more tangible. So it's something that patients can start to implement right away. We have other books that are a little bit more general. We have them all about the mental health industry as a whole, but I really like You Happier because it's things that you and I, patients, can actually start to implement every single day that will help to increase their mood. So I highly suggest anyone that's interested to grab a copy or, look at it on, a lot of different sites.
And there are specific, once you identify your brain or the combination of the type of brain that you have, there's then a list of lifestyle tips that you can follow and a list of supplements that you may want to look into. And I like how Dr. Amen titles them, like there's one for those who worry all the time. So, HTP would be for those who are the more worrying type, brain type, and so on and so forth. And I love the formulations. I deal with supplements all day long, and I think there is room for them, not instead of actually taking other steps in your life, but to like a complete picture. I love how we took saffron, who we know and research is showing us that can help with mood boost, how we found that saffron and zinc can work together with curcumin, and he made that happy saffron supplement that I tested on myself, because I test everything on myself, every single diet, every single supplement before I recommend it to my clients. And I took them when I'm doing clinical rounds at a hospital, which is really high, super tense time for me. And I took them just to see, my own data. And it's been really, really, really helpful. And that combination helps, as opposed to I took saffron in higher dosages before on its own, which didn't work as well. So you get everything in that book. I highly recommend that book to everyone.
Yeah, absolutely. That's good to hear that the Happy Saffron supplement made a difference. That's amazing.
It was great. And I'm always hesitant because first I check for purity, right? You want to make sure that it's pure, there's no additives, it's third party tested, there's no heavy metals. But I think I'm the best guinea pig to report back to my patients. Say, yeah,
Yeah.
it worked for me. It worked for me. You may want to try, or recommend it.
Yes, definitely.
Um, how do you how do you convey the messages of the efficacy of Amen Clinic's method to a doctor who may want to pursue collaboration?
Well, that's been a challenge because what we do is controversial to some degree. So, to some degree, it's been a challenge. But what I will say is that the industry is really shifting right now to be a lot more accepting of what we do. In fact, when we were at the APA conference this past year, they made a huge presentation about SPECT imaging and the work that we're doing. And so times are actually really shifting. But here and there, we still will come across some physicians that are maybe a little bit skeptical about the imaging that we provide or the, supplements or integrative care, things like that. And so I always like to come from the perspective of, I know that they are looking out for what's best for their patients. They want to make sure, just like you're describing, that, they've tried it and that they trust what they're recommending. And so I always say for those types of physicians to, try it out themselves if that's something that they're interested in. But also to kind of meet people where they're at, so we have some more traditional physicians that will actually refer to us, and it's purely for the imaging. And they use it just to be able to look for things like the traumatic brain injury or to look for, one thing we find is like toxic exposure as an example. So all types of things. So we can also meet people where they're at. Maybe they're not quite wanting to get involved with everything that we do, but you'd be surprised. We actually have some very traditional physicians that work with us.
I'm just surprised that it's not implemented in every clinic. Like the data is there. Everything is backed up by science, as us practitioners raised on. Everything is backed up by science. Results are incredible. What to be skeptical of?
Right. I think that people don't like change, myself included. I think that we don't like change. I think that when something's familiar, we've tried something many, many times. I think it can be really hard to change the scope of practice. So I think for those types of providers, just like you described, they've, been doing a similar treatment for patients. They know that it's worked out okay. And so it can be very scary to try something new or recommend something different. And so I think that's a big piece of it.
You remind me because with my PCP, my primary care physician, my previous one, I used to have beautiful arguments with him. I brought the integrative approach. He brought, the westernized approach. And at some point, I asked him, why don't you recommend supplements that may work for your patients along with or instead pharmaceuticals? And he said, it's like the wild, wild west for me out there. Because he wasn't trained on it, because it wasn't introduced in medical school, he, like you said, he's so set in his ways. This is what he knows to be working or not to be working, right? And it takes a really open-minded, a student for life type of mindset to be able to say, you know what, I'm going to go to outside my comfort zone and try this on my own, give it a shot and see if it works. And these are the MDs or the NDs or the IMD or whatever you want to title them. These are the practitioners that make a difference. It's hard to be a leader. Like I can only imagine what Dr. Amen had to go through to be ridiculed, to do something that he can be so proud of doing now. It's that shield that you need to shield yourself with, that confidence, that conviction that you need to take with you when you're a leader. Not everyone is born to be a leader. And kudos to Dr. Amen for being, I would say, our leader, because I use all his tools in my practice with such success. that this is the data that we need on top of the clinical data that is out there. So you are absolutely right. It's tough for people to get used to change and be able to go a different route for themselves.
Yeah, what you're describing, it makes me think of one of our physicians in LA. His name is Dr. Jay Faber. He's amazing. And a couple years ago, he decided, he is a very accomplished MD psychiatrist. He has written books. He's good with forensic psychiatry. He has all these amazing facets to what he does. And a few years ago, he decided he was going to go back to school and he got his master's in integrative medicine from George Washington. And when I asked him, what was his reasoning behind that, he said that, he felt that within psychiatry, he was missing a huge piece because, of course, as a psychiatrist, he was trained on the brain and trained on, mental health and all those things. But he felt like if he could understand the whole body, that he would make a much bigger difference for his patients. He felt like he was just missing that area. And so he went back to school and now he is such an expert when it comes to, integrative medicine, whether that's hormones, different toxic exposures. He's just incredible. And so he always says a specific quote and I can't remember it exactly, but it's exactly what you're talking about being a lifelong learner, always striving to learn more. He is just like the most perfect example of that. He should come on your podcast actually.
And I have the best conversations with him when I'm at the clinic
Yeah.
in Encino. Oh, yeah,
Yeah.
absolutely. And the fact that he
Yeah.
does forensic psychiatry, there's something about it that really, ooh, like,
Yeah.
I think
Yeah.
it's really cool. But yeah, that's a great example, you're right, of someone that was already accomplished, doesn't have
Hmm.
to prove anything to anyone. He's got the titles, but he felt that unless he connects the body to the rest of those systems, it's an event in our body is not an isolated event. It doesn't happen out of nowhere, right? There's got to be a connection between our emotional well-being to our physiological symptoms that come to the surface. The body's always talking to us, always, always, always. And this way we can't approach it just by numbing or suppressing one part. We got to attend to the whole body, the whole system. That's why I love integrative medicine. That's why I'm, finishing my doctorate degree in integrative medicine. It's fascinating.
Hmm.
I know
Absolutely.
that you said that you guys you're giving away free evaluations for firefighters. Can you expand on that?
That's right. So, right now, until we run out of slots, we are offering free evaluations for any firefighters that specifically worked in the recent LA fires. So if there's anyone listening or knows anybody out there that is, in need or just wanting to try it out, it's completely free to come through for brain imaging, doing a history with us, seeing one of our physicians, and even a little bit of the treatment afterwards is covered as well. So I highly, highly recommend for any listeners or any, friends of listeners, if you know anyone out there, please, feel free to spread the word.
Yes, 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 yes. And we're going to put it in the show notes. I think it's so important to help those who help us. That's how we pay it forward.
Exactly.
Before we wrap up, Sarah, what is one insight, piece of advice, or vision for the future of mental health or brain health, as Dr. Amin calls it, that you'd love to leave our audience and listeners with? Anything that can inspire them in their personal or professional lives?
Hmm. Yeah, what comes to my mind, and I can't replicate
What?
it the way Dr. Amen says it, but it's his line, like his tagline that he always will talk about. But he always says that, you're not stuck with the brain you have, and that, we can make it better and we can prove it. And so that would be what I would leave any listeners with is, anything that you might be experiencing, anything that your family might be experiencing, anything your patients might be experiencing, they're not stuck that way. And we know that we can improve it. And so I highly urge people to actually take a look at their brain, whether that's with us or anywhere really, and really get to the root of what they might be experiencing so they can go out and, live a great life.
Oh, that's so beautiful, Sarah. That's why I love you. You're such an amazing young woman, and I can talk with you for hours. Amen Clinics is so lucky to have you.
Thank you.
To all our listeners, thank you for joining us today. We're going to put everything that needs to be put in the show notes. And Sarah, thank you so much for being our guest on Raising the New Earth podcast. We'll see you later, okay?
Thank you so much for having me.
See you later. Bye.